Right, hello ladies and gentlemen, this is Yaya again, and we're looking at practical paediatric ventilation, and this time we're examining the Infinity V800 and looking at the basic operation. We'll be looking at how this ventilator works. We'll examine the initial settings, look at some of the basic ventilatory settings, and look at the alarm settings as well. So the V800 is a brand new ventilator released this January 2020. It's a touchscreen ventilator. It is very highly customizable and is menu driven. Now the problem with the menu driven ventilators is that they have menus behind menus, so sometimes it's difficult to find what you're looking for if you're not previously acquainted with it, but that's the purpose of these videos. Now the other thing that you need to remember with these ventilators is that there is a rotary knob which sits here, and anytime you want to change anything on the ventilator you have to then use the rotary knob to select your new value and then press it to confirm it, otherwise you don't actually make that change. So first things first, how do you switch one of these ventilators on? Well, it's really quite simple. You go to the left side of the main body of the ventilator, and there's a little panel, and this is the panel here. And you open that panel, and inside there's an on-off switch that's there. So normally we don't switch these ventilators off unless they're not going to be used for a few months. Hence, you've got this sticker here, do not switch off here. So they're usually left switched on all the time. Now once power has gone to the ventilator, you actually switch it on using the on button on the front of the screen. So that's at the left or bottom left hand corner of the front of the screen, and once you press it up, it lights up green, and next to it you see these other lights, and this tells you that the ventilator is plugged in and that both its internal and external batteries are available for operation should you need this. So this is a portable, well, it's not very portable, but you can move it, and it does have a battery life of 2 to 3 hours. So you can use it for transports to the scan and things like that. It's a bit bulky for that, but it is possible. So on the unit, this is a ventilator that's ready for use. It will be plugged into power. It will have both air and oxygen connected. It will be switched on at the back, and the on switch at the front would also be depressed. It would have passed a system test, and it would have passed a breathing circuit test. Now these tests are taken out or carried out by our staff, our ventilator technician and our senior nurses on the department. Now this is a touch turn confirm ventilator. So you touch something, you use the rotary knob to change the value, and then you press the rotary knob again to confirm it. So you touch, it turns yellow, you turn, the values change. Once you've got to the required value, you then press the knob again, and what you'll see, it then turns blue, and therefore you've made the required change. If you don't confirm within 10 seconds, what happens is the rotor you don't get the change, and the value returns to the previous value, so you just end up with your previous value. You've made no change whatsoever. Now this would be a V800 which isn't ready for use, and it's not ready for use for very many reasons. So first of all, we can see it's plugged in and its battery's alright, and it's set up for adult ventilation via an ET tube, but there's no oxygen supply, there's no air supply, it's not had its system test because it says not performed, and it hasn't had a breathing circuit test, so not performed. So this not yet fit for human consumption. The way the ventilators work are the vent tech or the nurses will first of all perform a systems test, and they go through various different things, and then you get a tick box against all of them, and which means that vent the system's working, so the ventilator's working. Then you have to connect a circuit and then go through these kind of like perform these tests, and once they're all green and ticked and passed, then you know that the system and the circuit is fine without any leaks. And it's at this point that you come in to then sort out the patient and therapy tab. So on the patient and therapy tab, it will tells you automatically what you're set up for. So it says you're set up for a pediatric patient to be ventilated by an ET tube, and it's on pressure control BiPAP. So up here you see a small child and an ET tube, and you know it's plugged in, and you know that the battery is fully charged. So you have all that information to start with. What you then need to do is go through your patient categories. Now it's clear here that the patient category we have are adults, pediatric patients and neonates, and these patients are separated by weight and by other characteristics. So adult patients, the weights go between 30 kilos up to 135 kilos. Children or pediatric patients go from 5 kilos to 50 kilos, and neonates go from 400 grams to 10 kilograms. So clearly there's some overlap between each of these categories. So, but it is important to put them into the category you think they belong to, because there are other attributes in the background which are set up based on which patient profile you pick. So as regards to the weight, we don't actually put the weight in, because all ventilation is based on height, not weight. So what should really happen is that you should know the height of the patient. You put the height of the patient in, and then you get the ideal body weight, which is calculated by the ventilator in the background, based on the height in centimeters. Now, most of the patients that come into us, we don't even know what their weight is, talk less of their height. So what we end up doing is adjusting this height until we get the weight we think should be ideal for that patient. So it's a bit back to front, but that's what we actually have to do with this system, because we don't know the heights of any of the patients, and we don't really have an accurate way of establishing that. So that's what happens under the patient category. After that, you need to decide what sort of therapy will be provided through the vent. So is the patient going to get conventional ventilation through an ET tube? Is this patient going to receive non-invasive ventilation? Or will this patient get high flow oxygen therapy? So those are the two things that need to be decided, and this patient is pediatric tube, pediatric tube. Right, so what mode of ventilation will this patient get? So the modes are all sitting down here. So you've got pressure control BiPAP, volume control SIMV, spontaneous CPAP with pressure support, and pressure control airway pressure release ventilations. And so these would be all modes that we would use on the unit. Now these aren't the only modes available. There are other modes, and you find those by clicking this other modes button there. And when you click that, all the other modes kind of like appear, and we can use these. We can easily select any of these for ventilation. Now we've selected pressure control BiPAP in this situation, but you can and what's happened based on the patient profile, patient category, and the patient height and ideal body weight, the ventilator has decided that this patient should be ventilated in air with pressures of 15/5 with an I time of 0.67 and a respiratory rate of 30. Now, It has decided this based on its category and the weight, and for most part of the time, if the patient has normal lungs, these are reasonable settings. However, we would expect that you would, one, inspect them, two, decide whether you accept them, and three, change them as if necessary based on other information that is available to you at the time. And you can change them here before you actually start them on any ventilation. Now there's a little I button, so quite often there are modes you're not familiar with. So next to the other modes button there's an I button, and if you press the I button, what you'll get is a nice little call out window which actually tells you all about the mode that you have selected. So here PC BiPAP is selected, so therefore you can scroll through this window which will tell you all you need to know about pressure controlled BiPAP. Now there are also some advanced settings. So next to the other modes button, which is on the far corner, the far right hand corner of the ventilator, if you click on that, which is this button here, then you get other advanced settings, and these are the trigger sensitivity, sigh breath settings, apnea ventilation, and automatic tube compensation. Now what you find here will vary depending on the mode that you have chosen. So these things that I am going to address in a different video, because there's far too much information under each of these things to address here at this time. But you do need to know that they do exist and they are available. So now, once you've done all those things, you need to look at the alarm limits. So given the mode you've set with the settings which I've helpfully obscured, these are the alarm limits that have been set in the background for this patient based on their weight, based on their ideal body weight and their patient category. So you would inspect those and decide whether or not you wanted to change them. How you would do that would be by pressing this alarms button. The other thing that's displayed here is this 80%, and what that is how loud is the alarm going to sound when you set it, and you also set this within the alarms button. So what we will do now is have a look. So you press the alarms little button there, and then you get this, and this shows you the minute volume alarms, the airway pressure alarm, the tidal volume alarm. So these are important because when you start ventilating the patient, you're not quite sure what numbers you're going to you're going to achieve. So sometimes the pressure will go above what you've set as your maximum pressure, and sometimes the patient won't get the tidal volume that you've set, and therefore if that's the case and that's what you're suspecting is going to happen, you can change these before you start ventilating them, or once you've connected them and plugged them in, then you can come back in and change them so that they're more appropriate values. The next thing to do then is to actually start ventilation, and the way we start ventilation is by coming again to the bottom right hand corner and pressing the start ventilation button. So it looks a little something like this, and when you press that, the ventilator then starts. Once you've started ventilation, you need to make sure that you look at the loops. The loops are actually very important, so that you can see whether or not the patient's ventilating well or not. You should have good size loops, which should be nice and solid. Yep, nice and regular, especially the pressure loops. You should have decent flow, and also the volume loop should also look. Each one should look the same, and you should be able to tell whether or not the patient's attempting to take a breath. So once you've started ventilation, you need to check the patient. you need to check the monitor. So the patient, you want to make sure that they're synchronizing nicely and not trying to fight the vent. You want to check the monitor, you want to see what the end tidal is doing, what the oxygen saturations are doing, and what the respiratory rate is doing, and whether that actually coincides with what you think the ventilator should be doing. You should check the loops, as I mentioned just a minute ago, and you should look at the ventilator and recheck the vent settings. So based on your SATs and the patient and your end tidal, are your vent settings appropriate? So if you've set a volume mode, go back and see what pressures those are generating, and if you've set a pressure mode, go back and see what volumes those are generating. As I said earlier, you need to recheck the alarm limits, and then again check the patient, make sure you're happy with the state that they appear to be in, and of course then check a gas within 20 minutes so that we know what's going on. So the loops I've mentioned earlier, and they're actually, again, they're quite important. So this is what a pressure loop looks like. This is a flow loop, which is probably the most important of all the lot, and this is a volume loop. And once you've just started ventilation, you want to see that they're all nice, good, solid, with decent amount of displacement from the zero value, because that's what will tell you whether or not the ventilator is ventilating properly. So you want to see chest movements, and you want to see good solid loops. Now, alarms. These are important, and we have different types. There are two main types. There are the yellow alarms, as you can see here, which is a tidal volume high alarm, and these are medium priority alarms. There are also high priority alarms, and they flash red. Now, both of these alarms need to be responded to very quickly, because it usually means the patient isn't getting the ventilation that you set for them in some way, shape or form. Either they're getting too much or too little, or something else isn't actually working properly. So you can have leaks in the system, the ET tube can be obstructed, and what would happen is the ventilator will alarm, and we would then need to respond. Now, the common response to alarms is to press this button here. So that's the alarm silence button, and when you press that, the alarm is silenced for 2 minutes. But during those 2 minutes, you're supposed to troubleshoot the alarm and resolve the issue. Now, the user interface is highly customizable, and normally the default view is loops and ventilation settings and common values that we look for, but it can look like this. Yeah? And all of these little windows and little squares, they're all changeable. So if you click on any of the loops, you can decide what you want to show in that loop value. If you click in any of the boxes, you can decide what parameter you want to see in these little rectangular boxes. So you decide what's important for that patient at that particular point in time, and you can put that on view completely. Now, also down the right hand side of the panel, there is this trends data view, or 10 trends data button, and what that does, you can look at trends of any of the data that the ventilator collects, and you can also look at bare data. So if you're worried about how much leak is coming out around the tube, this would be the button that you would need to press. You can view these trends in tabular view, which would look like this, or a graphical view, which would look like this. So there's a lot of information that can be gleaned just from the screen. If it's time to take the patient off the ventilator for any reason, either he's better and we need to extubate him, or you put him onto the transport ventilator so he can go to the scanner, then you need to now to stop ventilation. And the way ventilation is stopped is by going to the stop ventilation button here. If you click on this, you'll get an on-screen and follow the on-screen prompts that will ask you to first put the ventilator into standby before you then decide whether or not you'd wish to turn it off. So that's all I have for you at the moment. There will be more videos going into more detail on a lot of the aspects of the things I've touched on today. But in summary, today we've looked at the ventilator layout, we've looked at the basic ventilatory settings, we looked at the alarm settings, and we've discussed the fact that the user interface is quite customizable. The next video will be on the basic operation of the Infinity V800, and I hope that you'll find time to watch it. Thank you.